Welcome to Crosssite Evaluations, Lessons Learned, and a Sneak Peek into 2015 data. I'm Amanda Hopping-Wynn, Director of the National Abandoned Infants Assistance Resource Center, located here at the University of California at Berkeley. Today's webinar will be presented by Roopa Seshadri, a senior researcher at Chapin Hall. She has over 16 years of experience in child and adolescent health and well-being research. Current projects include leading studies that understand the population, poverty, and neighborhood trends in Chicago, evaluating the association between teacher retention and child outcomes among children attending Head Start in Chicago, and investigations into healthcare services received by children in foster care. Roopa has expertise in research study design, program evaluation, use of national survey and registry data, and application of statistical data analysis methodology to research and administrative data. Prior to joining Chapin Hall, her work focused on biostatistical applications and academic medical and health services research. Before we begin, I do want to remind you that you can ask your questions via the chat feature in that lower left portion of your screen. We will be holding questions until the end of the webinar, but please feel free to chat them in at any time. And now I'd like to turn it over to Roopa. Thank you so much for being here with us today.
Hello, good afternoon or good evening, everyone. I see that I am the last presenter, so I will try to keep it interesting and close out on a high. So thank you, Amanda, for inviting us to share our experience with the Crosssite Evaluation. So let me first start out by thanking all of the agencies and their staff for sharing their data with us. We totally realize and acknowledge that this was over and above your own local evaluations. So we hope that the data that we shared in the past, the reports, and the upcoming ones are in fact beneficial to you and will supplement what you're learning about your own evaluations when you get a sense of how the larger community is doing in this field. So I will just get started. I'd also like to acknowledge Jolene Andel and Aiden Dixon, who have been an integral part of this project over the last couple of years. So the first few slides, I'm just kind of going to go over, why Crosssite Evaluation. And let me tell you that I have actually been on the other side as well as a grantee and working hard on the local evaluation and had requests for data and other things from Crosssite evaluators. But I remind myself that it's definitely a worthwhile endeavor because when done right, it really has the potential to enhance all of our learning. So it's not, for many of you, it's possible that this is not the first time, because in general, a lot of the nationally funded projects often do include a Crosssite evaluation because the goal is to learn what's happening across various implementations of sometimes similar, sometimes slightly different programs, but that share some commonalities to get a kind of a more holistic picture of it. So they do allow for a more comprehensive understanding of program impact across a range of implementations. Because the specifics of each implementation can vary, they allow us to get a general sense of the generalizability of the programs, and very important to not just Crosssite, but any evaluation, they kind of also allow us to learn the different contexts under which a program works or does not work. So we'll go over just perhaps some of the barriers and challenges for Crosssite evaluations. And again, I'll just reiterate that these observations come from work that people have done, just studying Crosssite evaluations over years. I haven't included in this presentation, but I'm happy to share with Amanda, and maybe she can share the rest of you. There's this recent, about 5 years ago, there's this paper sort of summarizing the idea of Crosssite evaluations in general, which I think can make very interesting reading. So lack of communication, I would say, is the number one issue that both evaluators, grantees, funders all face when it comes perhaps not only to Crosssite evaluations, but even otherwise. I think what happens often is that the fact that there is going to be a national evaluation may not be communicated adequately or clearly upfront, and sometimes it does come across as a surprise after a project is underway, and understandably it causes challenges for time and resources if they haven't been adequately allocated upfront. Another considerable issue, and I think this was addressed in previous webinars as well, is the disparity in scope of data collection between local and national evaluations. Local evaluations basically are tailored to that implementation, to that community, and it allows you to dig a little deeper, whereas for national evaluations focuses on breadth rather than depth. So it's wider in some ways. It probably collects fewer data points, but the challenge is in identifying the set of common measures that can be collected across all implementations. So those kind of challenges go a little bit hand in hand. And the other issue is different data entry systems. Sometimes national evaluations have a dedicated electronic data entry process, and that could very well be different than what local evaluations are using. So then it really does end up being kind of a duplicative effort. And more than that, it could also mean that staff who are doing the data entry have to invest time in getting familiar with more than one data entry system. So, so kind of addressing those barriers, related to those barriers, there's a general set of best practices that have been developed around, what makes a successful or what contributes to a successful national evaluation. So, what we talk about here is somewhat going to mirror the points in the previous slide. I'll try not to be repetitive. But communication, we cannot stress enough the importance of that. And I say that as something that's important to even me as the evaluator, as the person doing the Crosssite evaluation. But the idea of I think the burden on the is to also convey to the grantees the importance and the rationale and the benefits of conducting this national evaluation. It's very important, and it goes a long way in investing efforts upfront to develop a comprehensive plan. Most things are much clearer in hindsight, but to the extent that all possible situations can be addressed ahead of time, it is very beneficial. And part of that comprehensive plan is really engaging grantees, including potentially local evaluators, in that process of developing the plan. Because getting support from the local grantees, and sometimes the evaluators, because in some cases it's the local evaluators are the ones who in fact share the data or have the responsibility of entering, uploading, as the case may be, data for national evaluation. So getting the whole team on board and investing the upfront time in it and getting their buy-in, I think is critical to getting the quality of data that we need for making the most of the data we have. So again, moving on to expectations around it, it's tied again with the best practices surrounding it, which is the understanding of each partner's responsibility. And I think this does come up a few times when, which is that if the local implementers are not clear about that it could involve extra effort on their part, or understanding, what their role needs to be in this national evaluation, it causes unnecessary problems down the road. and certain, it's important that grantees are aware of what's expected of them at the onset. And I think in this particular evaluation, it was a bit of a hiccup when the evaluator changed midway because, like, although there might be some standard set of rules and practices that go around an actual evaluation, we know that things change from evaluator to evaluator. So in this particular instance, I think an important lesson learned was there's usually an extra bit of effort that all parties need to invest when there is an evaluator change midway. And in this situation, it in fact did impact the timeliness of the evaluation in the transfer year. And as for the lesson learned from as the evaluator, I think what we take away from this is that it's extremely important to plan for ongoing technical assistance. And technical assistance is something that I think we can't necessarily foresee, but we have to understand and acknowledge that in this case 20 different implementations. I mean, you're bound to encounter a variety of experience levels across the grantee. So I think being available for and planning for, and I would say that, depending on the situation, maybe even planning monthly calls going forward. I think that's something we take away from this is perhaps be more systematic in allowing the opportunity for like a Q&A session. And it doesn't mean that there's always going to be questions, but it's when there is a forum, usually I think questions get asked that might be seemingly simple, but might save a lot of time going forward. Okay. So around the data aspects of things, the lessons that we can take away from this implementation is that there was no one single common set of measures across all the grantees, which basically then meant that several of the grantees had to kind of duplicate some of the data they were entering in their own system. So it definitely does result in duplication of effort. It definitely increases the burden on grantees, and I would say, and we haven't said this here on the slides, but I think it can lead to confusion sometimes because when we need this one common set of measures across all grantees, it's very possible that some of you may have been documenting similar but not exactly the same information. So it takes an extra level of scrutiny to ensure that in your local system and in our system you are entering accurate information without kind of conflating the two. Ideally, some of these lessons learned are around best practices, right? So you do want to develop the cross-site measure at the onset to the extent that the grantees can then incorporate those core measures into your own local data, evaluation data plans, right? Which is kind of along the lines of what I just said around, especially when there's just a nuanced difference between what you might be collecting for your local evaluation and what needs to be collected as a common set across. For the cross-site, unfortunately, at this level, the data has to be exact and we can't be approximate. So really, we would want to do this in conjunction before anybody's systems and data collection measures are finalized. That would be the best time to develop that. And another point of streamlining is data collection tools. That's I think a point that's less easy to kind of consolidate and streamline. Compared to streamlining the actual data points, but to the extent that they are possible, I think that effort should be made. So at this point, We're going to switch over. So I think maybe just to summarize, right? I mean, I think there are a couple major takeaway points when it comes to lessons learned around Crosssite evaluations. And let me say there are 3 points, and the top 2 are communication. And it's just to say how important that is. And the earlier you get in the process, the lesser, hopefully, the burden can be on the local grantees and the evaluators. So at this point, we're going to shift to an overview of the data from FY15. These are not the results. They're just a preliminary kind of first look at the data. So I'm assuming, and Amanda can let me know in the chat perhaps even, that even though we're shifting gears, is it better to wait till the end for questions?
Yes, let's hold questions till the end.
Okay, perfect. All right, so we will continue. So the FY15 data, so this was data that was collected through the end of the last previous fiscal year. And so I'll just go over perhaps a couple general comments on what was kind of from the data prep point what we did, so you have some context about these results if some things look a little strange. So what we did with the data was we streamlined all the IDs across grantees, and within each of the, I don't know how much you all remember, but there were like these 6 tabs on the Excel sheets that you all filled out. But that was done to enable us to track families across time, which is the time 1 and time 2, and also link caregiver/mother and child in some of the analyses we plan to do this year. Another thing we did, and the percents that you will see will not include any of the data that we're missing. So they're only all percents are calculated of data that actually had responses that were valid. And the only tweaking that was done to the data was to we included some logical reasoning strategies to exclude data in certain cases. For example, if the question was, did the child receive any services? And if the answer was no, but if the subsequent listing of services had any yes checks to it, those were not included in that. So we used the main question as sort of the guide. So if you said they didn't receive any services, then we ignored the follow-up set of questions. We're hoping that in the REDCap system that does not happen, because you should not have you shouldn't even see the subsequent questions if the answer to the lead question was no. So that's just some guidelines that we followed before we entered the data. So the overview is across our 20 grantees, there were 585 total caregivers, 635 children. And out of those 585, there were 156 who completed the program in this fiscal year and 137 who dropped out. I'll talk a little more about the completers and dropouts towards the end of the slide deck. I'm not going to read the numbers out to you on the right-hand column, but they basically give you a little more information about the range of the responses across the grantees. Okay, so here's an overview of caregiver demographics. What we will comment on in our report for this year is we'll kind of highlight some comparisons between the FY15 and FY14 data. Those analyses were not ready at this time. But other than that, this is just a snapshot of what our participants look like. More than half were white, and about nearly 30% were Black or African American. one quarter of the participants were Hispanic. Vast majority of the participants were between 20 and 40 years of age. And in terms of education, again, more than two-thirds had three-quarters, in fact, had just at most a high school diploma. Amongst the children, about the split between males and females were half, which is not a surprise. The race ethnicity breakdown was, again, similar to what we saw for the caregivers. Over 40% of the children were under a year of age. Again, I don't think any of this is surprising. But what is wonderful to see is that 96% of the respondents, the children were up to date in their immunizations. So at the next few slides, we'll go over some of the risk factors. So for this, of course, we've only selected a sampling of the data from FY15. It's kind of to pique your interest and hope that you will be eagerly waiting for the final report when it comes out. So maternal risk factors, just keep in mind that we had a total of over 500 participants, and 455 of the moms indicated a history of substance abuse. I realize now that I have used caregivers and mothers or maternal interchangeably. It's primarily mothers with a possibility of a few other caregivers if we have answers for them. And out of the 455 who have a history of substance abuse, about a little over a quarter report to currently still using alcohol or other drugs. The risk factors are generally listed in sort of a decreasing order of kind of prevalence, so that gives you an idea of which ones were more of a concern in the population versus less so. In about nearly 40% of the caregivers reported that a child was removed from their home due to abuse and neglect. So we'll see that, for the most part, and towards the bottom of the table, there's a short table which sort of groups the number of risk factors, and only under 10% had none of the risk factors, which may not be a surprise given that the programs exist to help and serve families with risk factors. But about over a third had between 1 and 3 or 4 and 6. So I think, but the number to me that I think is of note is that nearly 20% had 7 or more risk factors. So it's probably something that you as the program implementers will have a better perspective on than us. Amongst the children, so again, you'll find that, the number of responses in this is relatively fewer. There was a lot more missing data in some of these characteristics. We had that just about over half of the births were full term, and less than 20% were preterm. As far as birth weight goes, 2/3, which is 67% or 222 out of those that were reported, were normal weight. It's a positive thing that less than 2% were in fact very low weight. The point I just want to make, that, which is kind of a footnote on the table, is that this really does not include all the data that was reported. We had some that we think are in kilograms, which we will look into further and convert to, which are in pounds and which we will convert to grams. And there were some numbers that we just felt it was unclear whether they were true, they were valid or not. Child risk factors. Child risk, HIV exposure at birth and HIV positive status at intake HIV exposure at birth was at just under 10%. and HIV positive status was under 2%. But a good majority of the kids on whom data were reported, that is for about 400 of the 600-odd kids, 3/4 of them almost had a toxicology screen conducted at birth. And out of those almost 400 children, 40% tested positive for at least one substance. And amongst the substances that they tested positive for, methadone led the group at 12%, and all the others were under 10%. Sorry. So this is something that, so for the couple of the slides we have, only this one, there will be more in the report where we will break out the numbers by programs that had a substance use focus as opposed to an HIV focus, and that's because of known relationships between substance abuse or HIV exposure and some of these characteristics. So looking at child placement, and this is at intake, here's where we do see a lot of a huge difference. Only less than a quarter of children who were in substance abuse programs were at home with their biological parents, where there was absolutely no child services involvement, as opposed to more than 2/3 of kids from the HIV focus groups, focus programs. So there's sort of if you look at the various categories of child placement, in children who were in the substance use focused programs, there's sort of a wider range of placement situations that they were in, but primarily what we're seeing is that for a vast majority of them, there was some level of child welfare involvement, which is in contrast to what we see in children who were in HIV-focused programs. So this one, we actually, this question was basically about, I think there were about 30 or so various services, and the questions were around where the majority of the services was received by each of the participants. So for this purpose, for this presentation, we're kind of choosing, we thought this might be a more useful way of looking at the data. So what we've basically done here is listed what were the most prevalent services that participants received through an AIA program, and what were the most prevalent services that participants received by a program other than AIA. So we'll see that, participants basically say that the food, clothing, it's actually the top 4. I would say that more than half of them reported that they received these services primarily from an AIA program, and those are basically food and clothing donations, peer counseling, mental health counseling, and recovery support. So if you just look at the programs listed, regardless of the number of participants or the percent of participants, you kind of see just a different category of kinds of services in both columns. A lot of so in AIA programs, we're really talking, there's a lot of, the bottom 3 especially have to do with legal services and financial assistance, housing assistance. In this table, we basically only listed those that were reported by at least 30% or more. But I think it does kind of raise, it perhaps even aligns with the focus of the program. So this need not be sort of a surprising finding, but it's interesting when you see all the data put together. I think this may, in fact, be the last slide. So this is one where we just kind of come back to the completers versus dropouts. So what I'll just say here about, let me first just define dropouts for you. So in dropouts for this table, we included 3 categories. We included those who chose to terminate, chose to terminate services, those participants who were lost kind of to follow up because the whereabouts were unknown or the programs were unable to contact them, or who were terminated by the programs for noncompliance. So we classified those participants as dropouts, and completers are obviously those who completed the program successfully. So who are not included in here are those who are still continuing the program, or those who are not in the program but for other reasons. And for one reason could be that they actually moved away. So the point being that we're not penalizing them as a dropout, because if someone moves out of town to a different location, it's unreasonable to think that they would consider the program in this location. So looking at completers versus dropouts, one of the most, I think the most striking thing, the differences are in the substances they tested positive for. So this is kind of because amongst completers you have 44% who tested positive on methadone, versus in the dropouts you have, you don't have a higher percent in others, but other than amphetamines, you have 31% amongst dropouts versus just 11% in the completers. So this, and the value of learning something about completers versus dropouts could be in, as you go forward, this grant might have ended, but your services may not be ending. But if you can understand better those who, the kind of the characteristics of those who drop out of programs, it could be useful in a more intensive outreach efforts or general efforts in ensuring that they stay in the program. So for now, this is actually all we have in terms of sneak peek into FY15 data. We're very much in the midst of this. I will just point out, though, that like I said, these are kind of our first look at preliminary numbers, and as we were working through them, we identified a couple more cleaning things we need to do. So when you see the final report, for some of these tables, there might be minor differences, but that can be expected, but you should not see anything that's substantively different. So to that extent, these are really draft numbers and not ready for dissemination beyond this group. So yeah, again, I can't thank you all enough, and stay tuned for the full report. Maybe I'll just add a little more about the report to come itself. This year, since all of you have also very patiently responded to questions via Word questionnaires and spent your invaluable time on the phone with Jolene with the interviews, that will also be part of our report. So the report this year will have this qualitative component, and we'll try to kind of put it all together. Okay.
Can you give us an estimate of when folks might be able to see the report?
Just a moment. Sorry. So we're almost in the end of June. We're definitely hoping, sorry, we are hoping to have a full draft ready by the beginning of August, so hopefully soon after that sometime. Sorry.
No problem. All this travel. See, it catches up
all
with
this
you.
travel.
The first question I have from our participants is, on this table that we're looking at now,
Yep.
they're confused about the base N being used to calculate percentages. For example, methadone completers N equals 23, which is not 44% of the total N listed of 156.
No. So that will, you are correct. That N should be, oh, I'm sorry. I put the wrong number in there. That N is out of those who tested positive for at least one substance. So the N equals, thank you for pointing that out. That N is not 156, because 156 is the number of completers, so that is in fact incorrect. So the percent, I can tell you what the percents are of. The percents are of all participants who tested positive for at least one substance. So just tracking back, if 23 is 44%, so we're talking about a little over 50.
Got it.
Yeah, sorry about that, and thank you, because we'll make sure that, because this is a table we will plan to include in our in the report, so I'll pay attention to making sure that those numbers are corrected.
So that would also be the case for pregnancy status at intake?
That is correct. I mean, and it doesn't even make sense to put 156 in there because 156 is just the number of completers and the dropout is 137.
Right.
So those numbers should actually not even, those two N equal 156 should not have been there at all. So I think all it did is create confusion. But what we will do, in fact, is perhaps add total number who tested positive for at least one, then you'll know what that 44% is off. And we will do that. So thank you for pointing it out.
Great. And then more generally, how can the cross-site evaluation possibly reflect dramatic differences across grantees in population served, program goals, and services, et cetera? Is there a way to do that? Is that even possible?
Yeah, that's a really great question. And we keep thinking of that. You know, if you just go back, even like in the first slide in the data where we say data overview and look at the numbers, and I can go back to it if you want. It's almost there. There aren't that many slides. But the reason I'm going back to this slide is just to say that, you know, even though you look at caregivers 585 and you see how they range from 6 to 53, right, across the 20 agencies, right? So I appreciate that question as to how can this cross-site evaluation reflect that, not just in the total number, but in some of the other things. The thing we worry about is once you start breaking things down, the numbers get too small. And you worry, you know, so, and it may not truly be reflective of anything just because the numbers are really small. But, you know, understanding that there is an interest in that, we can, as we're developing the final report, we can certainly look at if there are certain characteristics or data points where we won't kind of violate any sort of data integrity by being able to show that variability across grantees. What I'm sure everybody agrees that we can't really do all of this grantee by grantee because that we'll just end up with too much information and it's not within the purview of and you don't, and that doesn't, there's no longer a cross-site evaluation if you start breaking things down by grantee, right? But to the extent that we can demonstrate the variability is certainly something we can look into, and there might be a few indicators where it's possible to do that. And if it is, we will include it.
What we had tried with varying degrees of success in the past was to find clusters of grantees that we thought could be similar. Again, with varying degrees of success, though.
Yeah, so, and I think that's a great point. But trying to then, as long as there's a way to define clusters, and one of the things we've been doing in this, or at least it was done in the last year's report, at least, was to break it down by, I think one of the slides here did have it. That was the HIV-focused programs and the substance abuse programs, right? That was kind of one. Is that kind of what you're talking about, Amanda? Sort of clustering.
I think that specific clustering was more dictated by the grant, and especially this year, we've tried to get away from that clustering because we've realized that for the large part, the programs who are traditionally considered HIV programs are serving families who are affected by substance use. So that differentiation is a bit artificial. But in the past, we've also looked at clustering, programs who are providing, who are more focused maybe on infant mental health or school readiness or, service-specific types of clustering.
No, that's a great point. And as you were saying clustering, right, I was thinking of, like we've identified programs that follow certain program models, right?
Sure.
But I'm wary of that a little bit because through our interviews and qualitative data collection, we've also, understood that perhaps for good reason, but even those implementations can vary significantly across grantees, that even clustering it by those who use this program model versus something else may in fact just unnecessarily attribute differences to the programs when it should not. Does that make sense? Yeah. So, but I think, but I totally understand. I think this is a great idea, and we can certainly look at the programs and see if there's a kind of broader way of grouping them. Because what we don't want is to end up with like 6 clusters with 2 and 3 each, right? Again, then it's falling apart from the cross-site kind of idea. But to the extent that it's 2 or 3 groups, let's say, for a few things, it might be meaningful to look at. So, yeah, thank you for the question.
And I think this also reflects kind of the greatness that was AIA in that the programs are really designed to be flexible to the specific community's need. So there is great variability, and there weren't, a list of 3 to 5 evidence-based interventions to choose from that you could then, naturally cluster the groups. And I think that flexibility, sadly, is what the Children's Bureau is turning away from now because of the challenges in evaluation. That being said, next question is, let's see, will the final report include any outcome data from the Time 2 data? Yes, it will. It will. We're really just started working on this, and we hit Time 1 first, basically. And we just want to be more intentional about what Time 2 data, and which is also why we put in a lot of upfront effort in developing those respondent IDs that would allow us to connect Time 1 and Time 2. So yes, we do. Okay. And then just to clarify, I had said that we're trying to steer away from looking at the data as substance use versus HIV programs because of the overlap a lot of times. Right. That being said, in the final report, we will still comment on places where there are substantial differences between those two groups, such as child placement and whatnot. So right. And I think, Amanda, we had spoken about birth characteristics potentially as the other one. Yes, birth outcomes. So yes, right? Yeah, birth outcomes. Yep. Right. Yeah, we will do that, yes. Let's see here. I guess your point is that, unlike perhaps earlier iterations, we won't just do that distinction for everything, but it will be where there's some reason to believe that there will be differences. Absolutely. Yes. Right. For grantees who are planning to file a no-cost extension, there's a question about whether they should continue to collect the Crosssite data during that time period. Oh. My answer to that is no. That the Crosssite data will not be, we will not need that for no-cost extensions. Do you want to review deadlines with folks who are on the call, though? Absolutely. So we had we sent out a note about advancing our deadline to August 31st this year, just recognizing that several of the grantees don't have a no-cost extension. So this gives us a month to do a quick review of download the data from REDCap, do a quick review of it,
And if we need clarifications or any such, or if there were issues with the download or anything, we can reach out to you. The goal with that, for that being that by the end of this grant year, we have FY16 data that is workable, and because we do plan to analyze those data via a no-cost extension.
Wonderful.
And we'll be happy to send out a reminder, in early August, if that helps, like about a month ahead of time, just because I think the last thing any of us want is in the last week that you have to scramble to put these in. I know in the past, there was a deadline of December, and there was some flexibility about it. But this time there's far less flexibility because it doesn't help us to identify, an issue with the data 2 days before the grant ends because we know that's not going to be resolved. So we'd really appreciate it if, and to that end, we've kind of also been looking at the volume of data entry. And so if there are any of you who have yet to, I know you have your data elsewhere, but if you had yet to start perhaps entering in REDCap, if you get a chance to start that sooner rather than later, because if any troubleshooting is needed, we can do that now and give you ample time to kind of complete it.
Wonderful. So it sounds like we should be seeing this final report in September, and then hopefully a final report for the next set of data in January.
Right. I mean, I think, Amanda, I know we're going to connect on the no-cost extension, so depending on whether it's a 3 or 4 month extension, I guess that's what it will be. Yeah. And to that end, that report will perhaps be a bit more condensed than what you will see for FY15.
Yes, absolutely.
It'll have fewer resources from our end, that's all. So, but, what we don't want, right, is all the effort that we put into collecting those data to go to waste. So we definitely want to see that. And that way, in some cases, we'll have 3 time points. We'll have 3 years of data to follow, which will be nice.
Well, Roopa, thank you so much for being on the call today. That's it for questions at this time. Obviously, if anybody has any questions that come up, feel free to email Roopa or Jolene or myself. Thank you to all of you who have been on this call and other calls over the past 2 days. This does conclude our Lessons Learned webinar series. We have recorded all of them, and they'll be available on our website next week, aia.berkeley.edu. So if you would like to share them with coworkers or folks who missed any of them, please feel free to do so. I hope you all have a great evening. Thank you again.
Thanks very much.